Kaushik to introduce himself and as well as the panelists for the first session. Dr. Kaushik, the time is yours.
Thank you, Dr. Hamam, and very good afternoon, everyone. I'm Kaushik Sarkar, the Director of the Institute for Health Modeling and Climate Solutions, IMAX. At IMAX, our mission is to harness the power of data, artificial intelligence, and different digital technologies to help build resilient and climate-smart health systems that can protect lives in the warming planet. With a background in global health strategy and digital transformation, I have had the privilege of leading efforts to design innovative solutions that address the nexus of climate change and public health. It's my privilege to welcome you all to the very first session of today's consultation, Climate Change and Public Health Intersection in Indonesia. As we all know, climate change is not just an environmental issue, it is a public health crisis in the making. And from vector-borne diseases like dengue to respiratory complications to waterborne illnesses, the writing is on the wall and the urgency is clear. Now, let me set the stage for today's discussion. The goal of this consultation is to not just scratch the surface, but to dig deep and collectively forge a path forward grounded in data, technology, and coordinated action. During this session, first, we will learn from three esteemed experts from the Ministry of Health, Ministry of Environment and Forest, and BMKG Indonesia, more about the intersection of public health policies and practices, environment and climate change, and climate information systems and services in Indonesia. Each speaker will have 5 minutes. I repeat, each speaker will have 5 minutes to share their perspectives, and I encourage each of you to get straight to the point. Once our speakers have shared their insights, we will transition into a 35-minute roundtable dialogue with all the invited experts. Now, before we begin, a few housekeeping rules, as you all know. Please keep your microphones muted unless you are speaking. Please raise your hand and wait for your turn to unmute, and use the chat function for any questions. I'll call upon each of you when it's time to contribute. Finally, we are here to move the needle, not just identify roadblocks. So let's ensure our discussions are sharp and solution-oriented. With that, let's hear from our first speaker. I'd like to invite Dr. Anas Makrouf from the Ministry of Health, who is the Director, Peniyahatan Lingakunkan at the Ministry of Health. Dr. Makrouf, the stage is yours, and we look forward to hearing from you.
Yeah, thank you, Dr. Kaushik Sarkar. Yeah, distinguished President of Korika, Prof. Hamam Riza, distinguished speakers, my colleagues from Ministry of Environment and Forestry, also from BMKG. I think I will use the time very effective. So please share our slide. Yeah. Okay, thank you. Ladies and gentlemen, as mandated by the Paris Agreement, parties are invited to envisage a long-term climate vision under a half century of strategy on low emission. And I think every country also give a national determined contribution. Slide. I think like with another country, Indonesia also facing the multiple vulnerability factors for health impact of climate change. like number one, demographic factors, uh, geographical factors, biological factors, socio-political factors, socio-economic factors, and another factors, I think. And I think that climate change is already impacting health in myriad of ways, including by leading of death and illness from increasingly frequent extreme weather, such as heat wave, storm, and flood, the disruption of food system, increases in zoonosis and food water, and vector-borne diseases. Also, like mental health issues. Furthermore, climate change is undermining many of the social determinants for good health, such as livelihood, equality, and access to health care and social support structures. These climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants or displaced persons, older populations, and those with underlying health condition. Slide, please. In this slide, we can see that some of the sectors regarding health sectors impacted by climate change. Number one is vector-borne disease. Some of the vector-borne disease will increase if we do not conduct some activities like mitigation or adaptation. Like malaria and dengue is part of the communicable disease that will be increased as impacted by uh, climate change. The second one, air quality as and respiratory health. This is also raised by the climate change. And number three, food security and nutrition. Number four, waterborne disease and sanitation. You know that we in Indonesia also facing the uh, uh, problem with the waterborne disease and sanitation access. So I think in climate change, Indonesia will face facing the problem regarding waterborne disease and also sanitation. Also, migration and health vulnerability. And then uh, another sectors like the decline of the fish catch, climate change is also likely to have impact on the uh, inhibiting lower elevation coastal zones. Next slide, please. This is also the situation of Indonesia regarding the uh, that we faced regarding the climate change impact. Indonesia is highly susceptible to flood due to heavy rainfall, sea level rise, and poor drainage infrastructure. In densely populated areas, flooding leads to contamination of water source, increasing the spread of the waterborne diseases such as cholera, typhoid, and diarrhea, which are significant public health threats. Slide, please. Indonesia is one of the part of the country that has a commitment to the Paris Agreement has been translated into the ratification of the Paris Agreement with the highest regulatory instrument. We, Indonesia, have a law number 16 years 2016. The implementation of the law uh, uh, as we have nationally determined contribution or NDC with the update and detailed roadmap for the implementation. Also, we have climate action plans and their integration to national and sectoral development plans, as well as development of long-term strategy for low carbon and climate resilience in 2050. Government of Indonesia has made considerable effort to achieve the target under the Paris Agreement. A number of innovative policies and measures are in place to support transformation in one. food and land use system to reduce greenhouse gas emission and pollutant. The number two, reduce vulnerability and increase adaptive capacity to climate change. Number three, conserve biodiversity. Number four, promote health diet. And number five, strengthen rural livelihood. Six, sustainable use of freshwater resources. And the seven, as well as to halt the loss of ecosystem services. Next slide, please. Also, the government of Indonesia committed to be part of the COP26 Health Program Initiative in 2021. Output of this commitment is set into three broad categories for action. Number one, climate resilience health system. This uh, this action to continue a climate change and health vulnerability and adaptation assessment uh, up to 2023. Number two, sustainable low carbon on health system. This section that we in Indonesia conducted developed a sustainable and low carbon healthcare system that contributes to meeting the Paris Agreement. And then the last, also we commit to increasing the funding for health. This facilitated and given data of updated Indonesia Health Nation Adaptation Plan 2020 to 2030 to third party who has access for the climate change multilateral funding mechanism like initiative in 2022 for the WHO and UNDP. Slide, please. Indonesia also commitment to tackle climate change impact is also reflected in the ratification of Paris Agreement for Law number 16 years 2016. That stated controlling climate change is constitutional mandate that everyone has the right to live in prosperity physically and mentally, to live and to have a good and healthy living environment and the right to health services. The Ministry of Health has given special attention to climate change with the issuance of Law number 17 years 2023 regarding health, which states that everyone has the right to healthy environment, whether physical, biological, or social. A derivative of Law number 17 year 2023 regarding the health, which has been operationally translated through Minister of Health Regulation number 2 year 2023 regarding the environmental health strategies and intervention. In addition to that, an important Minister of Health regulation related to climate are control communicable and non-communicable disease control, also overcoming the health crises. As a conclusion, Indonesia's experience at the intersection of climate and public health demonstrate the complex and multifaceted nature of climate change's impact on human well-being. Addressing these challenges require coordinated action across sectors, including health, agriculture, disaster management, and infrastructure development. Strengthening healthcare system, improving early warning mechanism, and implementing sustainable environmental policies are essential to reducing the health risk posed by the changing climate in Indonesia. So this is uh, uh, from our side, from Ministry of Health. Thank you very much.
Terima kasih Pak Anas.
Thank you, Pak Anas, for this superb and directional presentation that sets the tone for our rest of the session. Now I will turn to Ibu Lakshmi Dewanti, Dirchen Pengen Dalian Perubahan Iklim at the KLHK. Ibu Lakshmi, the stage is yours for presentation.
So, Dr. Kaushik, Pak Irawan Asad will speak on behalf of Ibu Lasmi, which is currently in the trip coming back to Jakarta. So
Wonderful.
there's a director of adaptation, climate adaptation, Pak Irawan Asad here. Silakan Pak Irawan. Masih di mute itu Pak. Masih mute.
Oke, terima kasih Prof. Hamam Riza atas invitasinya dan apologize for my Director General, Ibu Laksmi, that she can attend the meeting because she's on the trip in Yogyakarta, and I will represent her for this important meeting. And my name is Irawan. I'm a director of climate change adaptation, and I think it's really nice to meet you, Pak Risa, Dr. Sarkar ya, Pak Anas, ini kolega kami Pak, ada Pak Asap dari teman dari BMKG dan teman-teman semua. It is really nice opportunity to share what is going on the Ministry of Environment and Forestry, and maybe this is our last meeting using Ministry of Environment and Forestry, because today there is a new minister. It's only Minister of Environment or Minister of Forestry. So we just wait for that. The climate change will be
Ya Pak.
fall within this type of what kind of ministries, but sure with all of you, especially for this kind of activities, yeah, for the health sectors. Okay, I will share my screen, Pak. It will be easy for me to follow. Uh, yeah, sorry. Can you see my screen?
Yes, it is visible. Can you make it full screen, Pak?
Okay. Yeah, it is full screen now. It is full screen now. Okay, the climate change. I choose the adaptation strategy for this meeting because health sector is fall within the adaptation strategy in our blueprint or in our roadmap. That there are number of climate change impact that already happened in Indonesia. If you see this map, you already have this this data since 2022. So we map all of the impact of the climate change to all of Indonesia. So if we're talking about the health sectors, there will be a number of areas that impacted by that one. If you see this dot, dengue habitat, yeah, dengue habitat increase in North Sulawesi, dengue and malaria in Papua, and also the number of impact from drought, rice production, yeah, flood risk, flood frequency. So in here, you see that the climate change impact in Indonesia on the intensity, severity, and frequency. Well, if you can see these maps, that there is an also socioeconomic impact of this climate change, not only in the health sectors. There are 0.18 to 1.26 socioeconomic impact on the agriculture sectors. We will lose our production. We will lose our productivity in agricultures in 2050. This is very frightening, because in 2050 there are more than 4,000, yeah, 4,000 million people in Indonesia, and for food security will also impact our health sectors. Yeah. In the vector-borne disease is also increased. Water risk and water availability, water scarcity will be declining. And yeah, if you see if you look on the ecosystem, the fishery catch, a coral cover will be, and biodiversity loss, because biodiversity loss is like we call that one the triple planetary crisis: biodiversity loss, climate change, and pollution. So in here in Indonesia, that from flooding, sea level rise, urban heat island, extreme rain and drought is increasing. Yeah, and I was just meeting with people from sorry, Central Java. In the northern part of the Central Java is sinking because of the sea level rise and subsidence. It is really hard to see that there are people that every year they have to sink in 9 to 20 centimeters per year. So in the long run, their house will be inundated completely. It is also impacted our in health system. Yeah. I was in Pekalongan last 2 weeks ago and see how this sea level rise impacting their house complex and other is malaria and dengue infected in the area. This is the impact of climate change in Indonesia. So so what is Indonesian commitment for the Indonesia?
I think we have lost Park due to certain connection issues. Yeah, I think he is back. Park Iwan, can you hear us?
Masih di mute Pak Irawan, masih di mute.
Yeah, sorry for that. Yeah. I cannot unmute myself, so you have to give me permission to unmute. Okay, I will share it again. Sorry for that. Uh, I will share my slide. Yeah. Yeah. Since 2015, the numbers of documents
Pak
Park
Irawan,
Irawan, I think your voice is breaking.
published from our NDCs, National Determinant Control, NDCs, of the end that our end from
Dr.
to have
Lia, could you
navigation
please
up
connect with
this
Park Irawan?
number one the last 12 20 how to is and our yeah, sorry.
Andreas or Dr. Lia, if you could connect with Park Irawan for the connection, I think that would be great. And in the meantime, in the interest of time, I will turn to Park Ardhasena for the session. And unfortunately, we had the connection issue for which, and we can get back to Park during our roundtable. So I'd like to invite now Dr. Ardhasena Supahelu Akan from BMKG, who is the Deputy of Climatology at the BMKG. Dr. Ardhasena, the stage is yours for presentation.
Yes, thank you very much, Dr. Kausik, for the introduction. Good afternoon, ladies and gentlemen. Honorable Prof. Hamam, as the President of Corica, thank you very much for the kind invitation in inviting us to provide our perspective related with climate and health. So my short intervention will be on aspects related with aligning our national endeavor in integrating climate and health, how is it related with the existing global activities also related with climate and health. So the first kind of systematic effort to give an overview what is existing related with climate and health actually occurs. This was in 2012. There was a joint publication by the World Health Organization with the World Meteorological Organization. They published a publication consisting showcases that exist among countries in the world related with how they deal with climate and health issues, as well as some examples of operational services that exist. But at that time, only a few services exist in the world, although the intention is there. So let me give a brief explanation about the global framework for climate services. It is actually consists of 5 pillars, and health is one of the main focus area where we want to provide services in relation with climate change. So these five pillars includes observation and monitoring, the foundation of sort of our endeavor, the research part, including the university academician, the capacity development part, the user interface platform, and then lastly the services part, which is written here as the climate services information system. And responding to this publication in 2012, we were wondering ourselves whether we can actually make this. And then through a long kind of interaction among representatives from climate, health, academician, universities, as well as health actors, as well as the governments, we were kind of successful in launching our first working example of climate and health warning, climate and health services that was launched in 2019 in Jakarta. And last year, or this year, actually, we managed to duplicate that for the province of Bali. So we have 2 operational services for health, in this case for dengue in Jakarta on your left-hand side, and for Bali and on your right-hand side. And we are working now to extend this kind of services to other areas, as well as to other kind of diseases that are related with climate or climate change. And I would like to point your attention to this very important resolution of the World Health Assembly that has been just adopted in June 2024. Here is shown the picture of the Director General of the World Health Organization, together with the Secretary General of the World Meteorological Organization. The resolution actually really underlines the synergy among 2 communities to cooperate together in the global level, but also encourage the national level, in this case written here as the member states, to work closely together to work on climate and health related issue. And they point out several key encouragement for the member states to do, for instance, written here, to integrate climate data into existing monitoring, early warning, surveillance, etc., and to promote, also importantly, the inter and multi-sectoral cooperation between national health ministries and relevant national authorities on climate change. In this case, for Indonesia's case, is perhaps one of those actors is BMKG, which we monitor the physical aspect of the Earth evolution, in this case, climate in Indonesia. And for those of you who are interested to look at the details of this global level policy, you can Google and you can look for this resolution, which is actually quite interesting, but also at the same time very encouraging, because it aligns with what we are doing here in the national level. At the global level, this is kind of a governance push towards the integration with climate and health. In the national level, we have seen from the presentation of Pa Anas previously, the existing of the regulation that sort of facilitates the work that we are doing, but also during this platform, which is led by Corica in this case, with the support of IMEX and also with MBZ UAI. We are working on the expert level, and I think we are all moving synergistically in the correct direction. We have the proper regulation nationally and globally. So the challenge is to materialize and for us to make really good concrete beneficial services or information for the society in Indonesia. So if we look at, for instance, one of the pages of that publication, we look here the 7 principle of good practices of successful climate-informed health decision-making. I'm highlighting 5 among 7. And one of the important aspect is that really, for instance, number 3 is to co-produce integrated products and services. It means we have to use transdisciplinary approach. The climate expertise, the health expertise, the data expertise, maybe the people's expertise, etc., should be an integral part of what we are doing. So it is also highlighted here to harness transdisciplinary approach and information, and to ensure that actually the services that we are aiming at should be science and evidence driven. So I think these are sort of a verification or justification of what we are doing is in the correct direction, and I really encourage participation of all sectors involved in this for us to really make a benefit for the society. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Pak, for
Waalaikumsalam.
this
Thank you.
beautiful and wonderful presentation.
Yes.
And I would like to tell all the participants of the roundtable. So the idea of this blueprint actually came from the mind of Pak Ardhasena in one of our earlier workshop meetings, which we actually followed. Dr. Hammam and I continued that discussion, and now we are here where all of the different institutions and organizations are sitting together discussing this very urgent topical area. I would like to remind us that Pak Irawan had to leave at that point, and he's back right now. So I would invite him to complete his speech, post which I'll open it up for the rest of the roundtable experts. Pak Irawan, please.
Thank you. Thank you for that. There's a technical glitch in my side, and I will finish my presentation then. Yeah, because it's only one slide more. Yeah. Okay. So it's one slide more, and then sorry for that. Yeah, this is the last slide from my side because we are Minister of Environment and Forestry previously as a national focal point for the UNFCCC, and if you see in this scheme that we try to map all of these different entities that work within this adaptation of climate change. We separate this sectoral. So there are 6 sectors in the adaptation scheme. There is a food security, water, energy, health, ecosystem, and disasters. But in this 3 parts, food, water, and energy will be in one block. If you see the block, there is a coordination line that there's difference between health and ecosystem. Yeah. So health system, the health system will be there will be four main programs from nutrition, disease, surveillance, urban heat island, and settlement areas. And in here, there will be responsible by Ministry of Health, including Ministry of Investment, Transportation, and also the PAG and BMKG. But this from the stakeholders, or we call it the national entities. But also we are also responsible for the provincial and district government that running this program. So there is a provincial and district government that is responsible for technical guidance, yeah, for working groups and for adaptation into the village-based activities. I was in Semarang, Kota Semarang, 2 months ago. We discussed this city health plan related to the climate change. So It is, I mean, it is this type of activities now is running all of our district, all of our regions in Indonesia, and I hope that with your support using the AI and using this type of new adaptive technology, we can accelerate our adaptation program, our climate change adaptation program, especially for the health system that in the province and in the regency. Because we are not worried about in the national level. In the national level, the system is in place. We can run it. We can ANAS is or have they have a very nice system on that. But for the provincial and for the regencies, we need support for that one. And and again, the coordination between ministries is crucial in this part because yeah, climate change is not only impacted by to one ministries or to one sectors, but impacted to all of us. This from my side. Thank you for your attention, and we can discuss this part. Thank you.
Thank you, Park. And this session would have been incomplete without, this beautiful slide. I mean, both the slides are fantastic. And you actually closed with at the very right note of stakeholder coordination. So, ladies and gentlemen, and thanks to all of our speakers for their insightful presentation. And as we can see, it's clear that we have our work cut out for us, but the opportunities are also right in front of us if we are willing to think big and act boldly. Now, to quickly summarize, the speakers have discussed climate and health priorities, regulatory updates, cross-sectoral frameworks and opportunities, meteorological services, the quality and the attributes that climate information systems or climate health data need to have, and finally, the stakeholder coordination and the capacities that are highlighted for the broader adaptation purposes with health in the middle. Now we move into the heart of our session, a focused discussion, a roundtable discussion with all of you, where you can bring the perspectives to the table. And this is where the rubber meets the road. My role will be to just listen and keep us on track to ensure that our dialogue remains productive and solution-driven. I remind you that this is a solution-oriented meeting, and please be concise in your contribution, stay on topic, and remember, we are here to turn ideas into action. So let's dive right in and open up the floor to our experts. To begin, let's talk about the types of climate and health data that must be prioritized for real-time monitoring. So we have heard about the importance of integrating different data sets and priority diseases, but the critical question remains, what specific types of data should we be focusing on to stay ahead of these climate-sensitive health risks, and which institutions must take the lead in providing and coordinating which type of data? Your thoughts will help us anchor the entire blueprint for seamless data integration. I will remind us of our housekeeping rules. Please keep your microphones muted unless you are speaking. If you want to speak, please raise your hand and wait for your turn to unmute. I can start with our panelists, and in the meantime, please raise your hands to actively contribute to this session, because this is your opportunity to contribute to the blueprint. I would repeat the question. This is about the types of climate and health data. So what specific types of data should we be focusing on to stay ahead of these climate-sensitive health risks, and which institution must take the leads in providing and coordinating what type of information? So I'll first come one by one to each of our experts. So I'll turn to Dr. Anas first. Dr. Anas.
Yeah. Sorry. Yeah. What that I must be respond.
Yeah. So the question, Dr. Anas, is what specific types of data should we be focusing on at the intersection of climate change and health to stay ahead of the climate sensitive health risks?
Yeah. Oh, okay. Thank you. Yeah. So I think we, I mean, Minister of Health has good collaboration, yeah, with the BMKG, also with the Ministry of Environment and Forestry. So we need some of data from BMKG, and we also already get the data from BMKG, like the uh, air quality and the weather, and then the condition of the like some rain season, where is when when the when the rain season, yeah, come, and then will when the uh, apa musim bukan apa the like ya kering apa Indonesia has the two season, like weather and then yeah, dry season. Yeah, so I think this is very important for me, for us, Minister of Health, to know about the situation of the weather, because we can estimate the what the kind of the diseases that will be increased in the each of uh, session. So I think this is very important to us to get data from BMKG. Also, you know that we already has collaboration with BMKG, yeah, because we or that Pak Adelsena mentioned in the presentation that we already improved the early warning system. Yeah, some of the diseases that has the sensitive to climate, like malaria and also dengue. For the early step, I think for the dengue, we already conduct the early warning system, yeah, to increase the awareness in the community. So I think collaboration between Ministry of Health and BMKG is very important. And the second one, we already uh, has, I mean, Ministry of Health has close collaboration also with the Ministry of Environment, yeah, especially in the Pak Irawan Directorate, yeah, because some of the activities already conducted by us, yeah, between Ministry of Environment and Ministry of Health. Like we conducted the advocation and also socialization, yeah, among the healthcare workers, yeah, like puskesmas, like hospitals, like clinic, and another healthcare facilities. We conducted the the like how to make the low emission, yeah, among the healthcare facilities in Indonesia, especially in hospital, because uh, uh, emission from healthcare facilities, especially from hospital, also have a contribution, yeah, to uh, to increase the emission. So we conducted the socialization and advocacy among the healthcare facilities to how we make the low emission in the healthcare facilities. And another thing, I think we also need the data from uh, Minister of Environment, yeah, regarding the how many number, yeah, of the emission from healthcare facilities, and how to make the lowest, yeah, healthcare facilities to rise uh, emission. And I think we also need like what can we do to give the maximum of the national determined contribution. So I think the collaboration is very important, not only with the BMKG and Ministry of Environment, and also with another ministry or institution. Thank you very much.
Wonderful. Thank you so much, Ganesh. I think Pak Satyaji is also here and from the Digital Transformation Office, and their office leads the Status Health platform. So before turning to Ministry of Environment, from the Digital Transformation Office and from the perspective of Status Health, Pak Satyaji, could you please highlight or put your perspective on the table that what information do you think is critical at this particular intersection of climate change and health to ensure that both the climate information systems for health and the health information systems for the climate sensitive health risks are in appropriate sync at this point of time? Yeah.
Tolong di unmute Pak.
Thank you.
Sekali lagi Pak.
Okay, thank you. Cannot mute myself. Okay. Good afternoon, Mr. Hosik, Pak Prof. Hamam, and also Anas, my colleagues, and other colleagues from Ministry. Yeah, thank you for inviting me today to joining discussion. I think this is the very important discussion how we can connect from health data and then also from the others health sectors like climate. Actually, currently we already have a platform to integrate all the data coming from all the health facility. We use SL7 files. This is actually the common framework to make sure all health data can interact with us. And then regarding from your question, adding from Pak Anas, mentioned about the data. Currently, we already have some initiation or initiative within No Malaria and also supporting by Pak Hamam Riza, Korika, to integrate it and also how we can predict the malaria using the climate data, such as weathers and also not only the weathers but also the some immediate information and other things. So if we can talk about how we can integrate it with the data, actually we can use the SL7 as a format because SL7 currently support also for integrity between health data and also from the climate. And the other side also from the animals health, I think we can use this for integrations. And then the other side, we can use also like OGC for standards for geospatial data related to the environmental and the weathers. And then we can use the ISO 11073. Also can be used for interoperability between medical and environmental devices. Because sometimes we need the data real time. So it's very important thing how we can connect directly to the devices, especially for the weathers, for the rain, for the temperatures, and humidity, etc. So we can use also like OpenAPI, like REST or GraphQL for flexible data exchange. Important to ensure a consistent data model, especially privacy and also data security. That's it, Pak Kumar.
Thank you so much. And I would reiterate, those are two very important points, HL7 and the ISO standards. And we will work with the Digital Transformation Office closely as this document gets built up and developed so that those standards and the interoperability frameworks are in place in the blueprint for getting taken up for any systems integration. So I'll turn to the experts of BNPB. I know we have a few experts from BNPB here joining. So, and you lead the early warning systems in the country, the disaster management systems. So if you could contribute that, what types of data you feel very critical for integration from the perspective of climate change and health, especially from the disaster point of view? And feel free to raise your hand, or I can unmute as well. Or Dr. Hammam, if you want to specifically request any of the experts from BNPB, that would also be great.
A friend here, Ibu Tanti, who is coming from the Ministry of Environment, and she has some of the colleagues coming from the CSO. Bu Tantri, can you point out some of our colleagues or friends that wants to give input or comments to this session?
Dr. Lia, can you help in unmuting, or Andreas, if you could help in unmuting?
Let me do that. Okay.
Sorry, I cannot open my video. Yeah, because of my laptop. I'm sorry. I'm sorry. Regarding the question, would you also
I'll repeat the question. I'll repeat the question. So we have heard from Ministry of Health, we have heard from BMKG, and we also have heard from Ministry of Environment about some of the priorities of climate and health, and also the data and the information. So I wanted to ask that from the perspective of early warning and disaster management, what do you see as the priority data at the intersection of climate and health?
Yeah, I think regarding the data, because of the climate itself, the data of the rainfall and also the dry, how to say, rainfall, actually is very important. I think the real data, not the already, it's already how to say, but it's a raw data, everyday data. It's very important because it is needed for analyze how is the projection to the future. So the openness of the information from the BMKG is very important for us to predict the future of how is the climate projection in the future for 20 or 30 years in the future. So and the other is, I think the important thing is about how is because Pak Anas already mentioned about the very prioritized in Indonesia is malaria and dengue. So I think the data, the information about how many impact from the dengue is already been have to be recorded also in the facility like a puskesmas, and then we can get this from the puskesmas as a data for us to make a projection between the climate and also cross with the data from the patient of the malaria or the dengue itself. So I think this is what in my experience, but I think the Ministry of Health and also BMKG can also give an input about this. Thank you.
Wonderful. Thank you so much for this insight. Data is only as powerful as systems and people managing the data. And in fact, we saw one of the glimpses of this when Dr. Ardhana was making his presentation, and in the component framework, capacity was one of the biggest elements or highlighted elements. So what are the most urgent capacity building needs to ensure that the national and subnational institutions are prepared to not only collect and analyze this data, but also act on this data? So I would repeat my question. What are the most urgent capacity building needs that can ensure that the Indonesian institutions, both at the national and in subnational levels, are prepared to not only collect and analyze the data, but also act on this data? So I can start with Dr. Ardhana, and Dr. Ardhana, please feel free to refer to any of your colleagues at BMKG as well if you want. Post your thoughts on this.
Yes, Dr. Kaushik, thank you very much for that very difficult question. So let me reflect perhaps on our experience. So the kind of capacity building related with climate, and also making how can we make these efforts all the way to be beneficial for the society. So maybe let me divide it into three. So perhaps the climate data itself, the health data as a second aspect, and as a third aspect, maybe the enablers, if I may say so. So the academician, the universities, as well as the health or the society actors, which are on the last mile of or the receiving end of this joint endeavor. So for the first, for the climate side, I actually see that we are in a stage already that we can benefit from the long-standing work by the community of the by the meteorological community. So the all aspects related with the recording of weather and climate data has been standardized for a very long time, and we are benefiting this in the form of weather and climate information that we now have. Each elements of the weather or the climate is recorded in a very standardized way. It's recording at a standard time, measured according to a certain standard accuracy, etc. Although even the density of the observation network across the world or even across Indonesia perhaps is insufficient. But we can, of course, augment that with the models that we have already now in filling in the gaps when it regards to the requirement for the weather and climate. So for that aspect, I think we can already be quite confident that we can tick the box off it. So the second aspect related with the sector side, with the health side, I think this is from my personal opinion, here is actually the area we can encourage consistency when recording the health data. With our experience working on the dengue, we have seen variation across province on how this data is being collected, but also not in space, but also in time. So that there is an area I think we can work together and we can much improve so that we can consistently, historically link the relation between climate and health as sort of the core foundation of the service or the information that we want to create. So that is the second element when it relates with capacity building. I think we can address that. We can define a standard through a capacity building activity that will enable a standard recording of the health data. So for the third aspect, when it relates to the enablers, I see here we have to encourage more participation from people from the universities, from the research communities, attracting them to this really relevant also urgent issue related with health and climate, so they can join on board and help the meteorology community as well as the health community in modeling, in enabling these two, data and knowledge, to merge together into one platform or one service that we can do together. And also at the last mile, looking at our experience, we can always take benefit from the increased literacy, for instance, for the health actor side, for instance, in our case, when we are working with dengue, for instance, if we train the Jumantics, for instance, at the very last mile, we are really looking at the really beneficial activities from research to operation, from operation to service, and to service back to operation, where every actors in our community, including the data analytics community, can take part and give benefit. So that is my take on your very difficult question. Thank you.
That was honestly a brilliant response, and it is going to inform the blueprint as well. So thank you so much for that, Bhagat Sinha. Now, we have heard from you, and the last point was really interesting, bringing together the universities, the research institutions, and the agencies. And I know that there are several experts joining from BRAIN. If you wish to contribute in terms of our first question on the climate health data or the capacity building side, could you please put your name either on the chat or raise your hand so that we can help you unmute and contribute to this roundtable? Not just on this table, you can respond to in the upcoming tables as well. So I'll pause for maybe 15 seconds to see if any hands are raised from any representative from BRAIN or any universities or research institutions. I can turn to the person. Hearing nothing, so I'm turning to Pak Irawan for the last question in terms of the capacity and data. So from your perspective, Pak Irawan, what do you feel important as a crucial climate and health data? We saw the frameworks in your presentation, and we also saw the coordination aspects of the work. So if you could let us know what kind of capacities would be critical to ensure that the right data are available at the right time, the right place to inform the policymakers who are dealing with the adaptation policies.
Okay. Yeah, thank you for your question, Pak. Now, currently we are developing the climate change vulnerability index data information systems. Okay. So, and Minister of Health also developing the system, they call it climate change health vulnerability index. So in my perspective, that we need to sit together to interoperability these two systems. So in general, we have the vulnerability index data for the climate change in the whole, but also they have a feeding from this type of vulnerability index data from the health sectors. That's the first thing that we need.
I think there is a bit of connection challenge again.
Yeah, I think there's a problem there, Dr. Kaushik.
Yeah, we can turn to our last recommendation aspect then, to have quick thoughts on the capacity building and data integration. we wanted to also explore that how about the potential establishment of a strategic hub for designing these data intelligence systems at the nexus of health and climate change. What kind of capacities and the data would be required, and what kind of collaboration would be critical here, especially knowing that different universities, partners, and stakeholder institutions are present in this room. So what would you feel as the most critical component that your universities and institutions could bring to enable the capacity and ensure that a strategic hub could be formed for designing climate smart health systems informed by climate information systems for health?
Can I?
Yeah, please.
Yeah, thank you very much. Yeah. So I think the contribution from university to the uh, uh, like activities or movement regarding the climate change impact, I think very important. Yeah. So like from our side that we also encourage the university, yeah, to first I think conducted the mainstreaming of uh, the impact of the climate change, yeah, to the community. The second one, already we need the collaboration between our ministry with the uh, university. Like we need the rising of the center of excellence among the university. So in this year also we already conducted some of the application to university in Indonesia. uh, we hope that some of the university, build like center of excellence, because not all of the university in Indonesia have a center of excellence regarding the climate change uh, control. And last, I think we also need the contribution from the university regarding the analytic of the disease, like some of the diseases that sensitive with climate, yeah, with the situation of the climate. So I think very important, yeah. Like we Ministry of Health also has the vulnerability maps, yeah, and we collaboration with the work together with the ITB to build the vulnerability map regarding the stuff of the diseases with which are sensitive to climate. So this is from our side. Thank you.
Thank you so much, Paganas. And I know Pakirawan was cut out or cut short from the discussion because of the connection issue. So I'll turn back to him. If he can hear us, and ask him to unmute. Oh, sorry.
I think
Yeah, I'm so sorry for that.
to start the. Okay.
Yeah,
We can hear you, Pak.
yeah. Sorry for that. Maybe because I'm still using the uniform of Minister of Environmental and Health and Environment and Forestry. I have to change my uniform today then, so that's why I cannot.
Of
But
course.
congratulations
Okay.
on
Yeah.
having,
I'm just
you know,
continue with Pak Anas previously that what will be the what are the beneficiaries of working with universities and academia in our context, because we are bureaucrat, isn't it? Ministry is a bureaucrat part, so we need a people that from outside us that have knowledge on the activities on the climatology data and data to not to teach us, but to give an understanding that how we interpret the data and how to understand the data and how to communicate it with other stakeholders. That's the important thing with working with academia. The second part, because if the academia talk about the scientific part, so it must be true. Yes, must be true because it's coming from the very representative agencies. So that's why we need to collaborate with university. And in KLHK, we are collaborate with IPB, ITB, number of center climate change centers in the number of university in order to build that one. And the last one is called in order to build the capacities, capacity building for not only for the students but also for the government in their respective area. That's my perspective on how we need to collaborate with academia and universities. Thank you.
Thank you so much for this. So in the interest of time, we have come to a closer of this particular session, and we can move to the next session. I'll quickly summarize the biggest points. So we have prioritized cooperation or collaboration among different institutions. We have talked about different types of climate and health information and the data interoperability, the transparency, as well as the integrity of framework. We have talked about the capacities, what need to be built across the different levels. All of these aspects will be captured in the draft blueprint and shared with you all for your feedback again, so that we can have an informed blueprint and agreed upon blueprint. And finally, we have heard about the need to bring together the science and the policy to ensure that the actions are taken based on evidence as well as through cooperation between academia, research, and policy and programs. So with that, we will close our first session. I thank all the expert speakers as well as the roundtable experts. Before we close, Andreas has requested that we can have a screenshot of with our cameras on for this particular session. So I'll request everyone to put their cameras on, and Andreas, let us know when the screenshot is done for this session.
All right, I'll start in a count of three, and then I'll do two screenshots. So I'll do in 1, 2, 3. Okay, another one. 1, 2, 3. Okay. All right. We'll be moving forward for the second session. Thank you so much, Dr. Kaushik. The moderator will be Prof. Hamam Riza. The floor is yours, Prof. Hamam Riza.
All right. So, Assalamualaikum warahmatullahi wabarakatuh. Greetings, everyone. This session, the second session, we will still be talking about climate smart Indonesia and how we advance data science and AI for the climate resilience. So in this second session, we will have a few of our distinguished speakers here. Professor Bambang Rianto, Dr. Dini Makfira, and of course, my good fellow Bapak Setiaji, Chief Digital Transformation Office, DTO, Kementerian Kesehatan. And I will just go ahead and start the discussion by posing these two specific questions to all of the speakers. First is, what specific interoperability standards and data sharing protocols need to be implemented to integrate platform like Satu Sehat and Satu Data Indonesia? Satu Sehat is Setiaji, and Satu Data Indonesia is Ibu Dini. So this two kind of platform will ensure that data from multiple sectors such as environment, meteorology, health is fully harmonized, synchronized, and we can take a full benefit of having this data being shared and interoperable. On the second question, what are the immediate AI, cloud computing, and digital technology needs, and what investment should be prioritized to fully harmonize climate health data and operationalize a nationwide decision intelligence system. And with us today also, we will have Professor Bambang, which is part of the expert team on the AI readiness Indonesia country report that can have quite important findings from this activity, which can be shared to respond to the second question, as well as we are also open to, discuss on the first questions. So for that, I will just go ahead and start by welcoming ladies first, Ibu Dini, which happens to be in Milan at this time. So I would like to have her time first, if you don't mind, Professor Bambang, and let Dini to share some of her thoughts. Ibu Dini, please, the time is yours.
Thank you, Prof. Hamam. If everybody can hear me clearly? Okay. So, good afternoon, everyone. Pak Astiaji, Prof. Bambang, Prof. Hamam, Bapak Ibu sekalian, very good afternoon. I'm sorry if the connection and also reception coming from my side not really good, because I tried to do a tutoring, but I'm not sure whether my mobile phone can work very well to like reach out. So probably I will like turn off my video, so that's gonna be hopefully improving the reception to your side. So thank you for inviting us, Prof. Hamam. It's been very pleasure to sharing information and also anything regarding data governance. So we've been working very close in talking about AI readiness and methodology for UNESCO, and we understand that an accurate and also a credible data will be very, very important when we are talking about artificial intelligence transformation, digital transformation, and also data governance at the national level itself. So if I may share like one slide probably to answer your question from the first question regarding the standard and also interoperability. If anyone can help me to share the slides, I think we can just jump into the wheel slide, slide number 3. So, or maybe we can start with number 2. So actually, in a couple of weeks ago, slide number 3, sorry, you slide number, no, back to RPJP, back again. So a couple of times ago, like probably less than a month, we already know that we have a new undang-undang talking about long-term national development planning, and data is very, very like mentioned a couple of times. So it's not only supporting digital nation itself under digital transformation, but also we are very concerned in how to govern data at the national and also local level. So that's why we mention it in the national development, long-term development planning, part of Golden Indonesia 2045. And when we extract it to the medium or 5 years development planning, data also become very important, because we also put one data in the last part of the medium national development planning. So we want to making sure that everyone really has a concern in how to govern data itself. So Pak Astiaji probably will talking about how Pak Setiaji and all the team governing data in health sectors. But since we are also talking about the combination between health and also climate change, so it's gonna be very important if we talking not only in one sector, because we believe when we are talking about data, it's gonna be very, very connected one each other. So if you can next go to the next slide. So I'm sorry, I didn't create it in English, but I'm trying to explain it in English. So when we are talking about data, uh, we cannot only jump in how to collecting and also do a policy making coming from data driven policy making system. It needs to be started from planning itself. Like we build a house, we really need to know um, like the cost of the materials itself and how to build the house itself, how to kind of like creating a good like a low cost house. And so meaning that we have a target. So when we are talking about target, it's also we are talking about a national target. So to reach the national target itself, we need to prepare a planning. So when we do a planning, it's not only a planning, a programming planning, but also we need to do data planning itself because from the planning from the for the data, then we can understand how we need to do and collect the data itself to making sure that at the end we will have a single source of truth where we want to create a data-driven policy making. So talking about back to your question from Hamam, talking about setting up a standard, uh, Satu Data Indonesia has like four standards need to be applicable and also implemented at the national and the local level. So because we understand when maybe if we only talking about one sector, so one minister can applying or like conducting one standard, but when it's done, it came to a multi-sector, so we need to create like a national standard. So then when it's come to the standard, we have four standards that need to be followed uh, following all the agencies. The first one is the standard, standard and also metadata. So metadata, when we are talking about metadata, we really need to talk about how data is being collected, how to be used, and also how to be released. And also the next one, it's going to be very important. It's when we are talking about interoperability, it's the code of reference of data itself. We've been very long with Pak Siaji team. For instance, like we preparing a code for um, a Unicode for Pasienkes, Fasilitas Layanan Kesehatan, or like a health facilities, to making sure that when we want to intervene health facilities, let's say it's one by name by address or like by facilities by address. So to making sure that we do a correct intervention to one facility, so it's gonna be requiring a code of reference. So then we created like a code of reference standards. So if we already started this year, we work together with the Ministry of Home Affairs when we are talking about regional code. If you go to the next slide, I can show you how it's work. And we already creating like a dynamic standard in implementing a code of reference principle. Next. And then also we can talk about interoperability in this term. Next slide, sorry. Okay, so this is one of the example of the code of reference, how we creating a standard for a code of reference of the regional basis. So in this term, Ministry of Home Affairs is one of the data custodian for code of reference for the national region up to the village level. So we want to making sure that all the intervention gonna be intervening correctly in one village. So you can see it's already applicable in our portal data.go.id. So every subscriber who subscribe to our portal can be informed whenever there are any changes in the code of reference. So then it can be making sure that everyone who use this code of reference can follow the up-to-date code of reference. And then it's already collected in our catalog, data catalog in portal data.go.id. So when we are talking about AI, when we are talking about machine-to-machine connection, we're gonna be goes to work together with the Ministry of Communication. But if we want to provide information from machine to human, so everyone can also download and use all the data coming from data.go.id. But going back to your question, Prof. Haman, when we want to build AI ecosystem, so we try to making sure that these machine-to-machine ecosystem can be implemented by following all the standards coming from the One Data Indonesia, and also following the guidance of code of reference standard. So we really want to help all the institution, all of the agencies, stakeholders can use the data as their own basis when they are creating policy making or any intervention. So hopefully that can answer the question, Prof. Haman, coming from the national level standard. Because
Right.
I'm sure that when we are talking about sectoral, Pastiaji can share how Ministry of Health creating standard for health sectors. But when we are talking about multi-sector, so then it comes to satu data initial standard. Okay, so
Okay.
thank you. Hopefully that can answer the question, Prof.
Right.
Haman.
Yeah, I hope you can stick around. We will have a discussion later on, and we will just go ahead and ask for the next speaker here, Pak Setiaji from DTO, Ministry of Health. The time is yours, Pak Setiaji. Prof. Bambang, please wait for the next turn, right? Okay. Please unmute Pak Setiaji. Okay, unmute.
Okay, thank you, Prof. Hamam and Prof.
Okay.
Bambang, Bu Dini. Yeah, I will. Yeah, I will share first thing. Sorry. Yeah. Okay, talking about the integration, interoperability, and etc. The important thing is we need to develop the standard, not only about the how we can integrate it within the legacy system, but also the other side is how we can develop a standard for variables. In Satu Sehat, we start first to develop a platform, and then we put in the standard on top of this platform to make sure all the all the legacy system can connect with us. So because of that, so we put in the international standard SL7s for the data hacker to make sure we can communicate within the different system. The other side, we as Bu Dini mentioned, yeah, we already also developed the standardizations, not only the clinical standard, but also the other standard like health facility numbers, drugs numbers, also the patient numbers and the doctor's numbers. And then the other side also, we adopt the international standard for the laboratories using the loggings. And then we can use the logging also as the climate data standard, for example, like withers and etc. And then the other side, we also have the sonomicity or terminology. It can use also for others standard from the others data from coming from the non-health like animal or veterinary health. Yeah, we can also use these standards. So with this standard, we hope to make sure not only we can develop what we call the One Health data, but also to make sure can interwork within data within the health sector, but also with another data coming from other sectors. And then the important thing also, we can consume all the data coming from their different system to others ministry, to others regionals like province level, city level, etc. And then also the important thing also the people can access their data because the data is also, is coming from citizens. Beside of that, the important thing also to make sure all can be interoperable and also make sure can the health facility can share the data. The important thing also we need develop the regulations. Yeah. As I mentioned, Budini, yeah, we also have others regulation like law of number 27, law number 20, law number 12 of 2023 on health sector, etc. Yeah, this is some of example how we can integrate the data coming from others sectors like leaders coming from the BMKG, and then also data coming from health sectors and the other side. Yeah, so the data is saved not only in the text base, but also how we can provide in the GIS formats. Yeah, because of that, it's very important thing. Also, we can collaborate within the BIG to make sure all the standard like spatial data and also can be visually in the dashboard. And then currently we also now to connect with others data like air quality index. Yeah, we with the Pak Anas, yeah, to make sure this data can consumed by the people and also consumed by others to make like a predictions for another disease, like lungs, etc. Yeah, I think I stopped till this slide now.
Okay, thank you very much. Just right on time, Pak Setyaji. We will have many more times to discuss some of the very interesting slide that you have shown and shared with us at this time, especially with the work that you have carried out for Satu Sehat. So let's just turn to the next panelist, which is Professor Bambang Rianto, to share his thought on data governance and based on the AI readiness report that we have run throughout Indonesia for the past few months. Okay, the time is yours, Prof. Bambang, please.
Thank you, Prof. Hamam and distinguished speakers. Can you see my slide and can you hear my?
Yes, indeed, yes, please. Right.
So today I would like to share with you briefly about the Indonesian Artificial Intelligence RAM Readiness Assessment report. So let me start by sharing with you what is RAM and why does it matters. So RAM is a UNESCO readiness assessment methodology that can help us to set out ethics and policy on par with global standards. And this framework can help us identify areas for AI ecosystem development to ensure the adoption of AI is effective, ethical, and responsible. And it includes legal and regulatory, social and cultural, education and research, economy, technology, and infrastructure. In terms of regulation, we found that our government has passed laws that fix the UNESCO RAM standard, but most of it needs updating or needs more time to evaluate properly. I would like to focus on the data protection and privacy laws, which contains informed and consent mechanisms, a right to be forgotten and protection for minors. This is already there. And in terms of data sharing and accessibility, there is the progress that sets a government-wide framework for data standard and accessibility. And our recommendation in terms of regulation include the updating of the AI existing regulation, including the National AI Strategy that was launched in 2020. There is a need for investment in AI standards and implementation. And we feel that there there must be a balanced approach to AI regulation that compromise between innovation and also regulation. We also need the regulatory sandbox for AI innovation, and there is a need for collaborative and inclusive governance. In terms of social and culture, we recommend that there will be effort for AI literacy across different communities and public, and accessible to AI knowledge and resources, and clear strategy on cultural prevention. In terms of research and education, our recommendation is to improve AI literacy and education, collaborate with key stakeholders, and accelerate digital and AI talents development, establishing overarching strategy on national AI research and innovation, and optimizing research coordination. And in terms of technology and infrastructure, our recommendation is that we need a better supporting technology and infrastructure for AI development. We feel that we lack of high performance computing resources, and that investment should be established to provide powerful computing resources for AI development. There is also regional disparities and access, and programs has to be established to ensure affordable and cheap for AI utilization to be meaningful and widespread. So in terms of economy, our recommendation is that we can have use cases and leading by example, and push for more investment opportunities in terms of AI talent development in AI infrastructure, and set up of labor market strategies, because there is a fear that AI may replace some jobs. So finally, I would like to raise the needs for ethical AI adoption in Indonesia. Thank you.
Okay. Okay, thank you, Professor Bambang. I think very much we are expecting that we will discuss further on the presentation that you have given us, especially that we are trying to tie in some of the presentation with the question that I have posed earlier regarding the use of AI, cloud computing, and many others in order for us to support the national regulation on data, as well as how to achieve the interoperability of this data using the data standard that have been established of, or we can say in the making. So let me stop the presentation and probably again, before going further with our panelists here, I would like to invite some of the experts that are currently present for this second session. Again, I will pose the questions on this data standard and national regulation. What specific interoperability standard and data sharing protocols, and what are the immediate of AI, cloud computing, and digital technology needs, and what kind of investment that we should be prioritized, especially with the new government in place. We really like to see that uh, that some new investment on data integrations and harmonizing various sectors, which of course with the generative AI, we are we are producing tons of data actually at this time, and certainly we need to hear from all of you regarding the standard, the interoperability of data standard, and many others. So I would like to invite some of our colleagues here uh, that are present today. Let me see. I'm also welcoming your uh, hand, uh, your raising hand, if you want to speak up and provide your comments. Anyone?
Yeah. Okay.
Okay. Pak Setiaji, you want?
Yeah. Maybe I will highlight again about the interoperability, especially for specific standard we can use for the healthcare and also environmental and leaders. Yeah, as I mentioned before, we can relevant international standard like SL7 fires. Yeah, for because in these sectors already also, yeah, I mean, we can use also other data coming from the environmentals, coming from the climate, etc., using this framework. And then we can also edit other standards, for example, like OGC, for geospatial, yeah, especially for the environmental readers. The side for medical and environmental devices, yeah, we can also using another standard, yeah. We call this EEE IEE 11073. Yeah, this is a common standards in the international standards. We can use it. Also, we can combine other standard like OpenAPI, REST, Grab, etc. To on top of this standard to make sure can be interoperability within others data coming from health sector and also others sectors.
Okay. All right. So, if my question to you, Pak Setiaji, if we are going to establish this data interoperability, take for example, if one of our hospital or even from the national insurance institution like BPJS, how do you see that this data can be, integrated into one potentially,
yeah,
which cover most of the aspect of
yeah.
Satu Sehat, for example.
Yeah, the important thing first about the standard itself. I mean, like the BPJS already have ICD-10, ICD-9 for clinical data. So we also use this ICD-10, ICD-9 to make sure can be interoperable. This is about the standard for the variable or the data. But to make sure it can be get faster, because usually the medical record is like a bundle. Not only have a diagnosis, but also like medications, image, and also sometimes we can put in like others data coming from medical diagnosis. So we use the SL7 as a bundle data, not like a table. Because of that, it's very important thing we combine data standards. It's mean like ICD-10, ICD-9, and also Sonoma City login for the lab. And then using the FIRES SL7 as a bundle data. So from the BPJS, currently already converts the data to the FIRES. So we can do a data exchange within the Ministry of Health and also within the BPJS. What for use? Actually using for to avoid like a fraud, yeah, and then also to fastest the claim system, the claim system for insurance. Yeah, that's it, Pak.
Okay. Okay. So, yeah, because certainly I want to discuss further for our next step, yeah, actually. So looking at what the Climate Smart Indonesia partnership, we try to orchestrate a task force under certainly the leadership of Ministry of Health, but we want this to be in coordination with the KLHK or now Ministry of Environment and also Ministry of Forestry, if needed, and certainly with the BMKG to draft the standard if it is not available yet. Do you think that this is going to be our one of the low-hanging fruit for Satu Sehat to draft this standard? How do you see that, Pak Setiaji? And certainly, I want to ask also Professor Bambang Rianto, which is also working on this data
Okay.
governance.
Yeah, maybe we can looking out or see the regulation. In the regulations, especially we already have the regulation Omnibus Law, the Act of in 2023 for the health system, 17. I mean. In regulations, mandate the Minister of Health develop the standard for the health data interoperability. So all the health sectors should comply with the standard already developed by Minister of Health, including the BPJS. Because of that, is very, I think, better we can talk how we can develop the standard within the health sector data and also other health data, and then we can define. Usually we develop the playbook, yeah, because very important thing to inform others stakeholders to make sure knowing the standard, knowing the metadata, variables, how we can connect using the API, etc. So we can develop the playbook together within Ministry of Health and others ministry, and then we can do together, yeah, to decisions this data interoperability, like a technical guideline. Freeze.
Okay. Okay.
Yeah.
Prof. Bambang, you want to comment on what has been said by Pak Setiaji?
Yes, Pak Setiaji already mentioned about HL7, ICD-10, ICD-9, and also DICOM for radiology and imaging data and associated regulation. But let me mention about the data standard that can be divided into two aspects. Data exchange standard, that's there are a number of standards that already exist, such as EU specification, ADMS, ISO, OASIS Open, ETSI, as well as Open API that's already mentioned by Pak Setiaji. There are also a standard for data modeling, such as European Commission, World Wide Web consortium, such as JSON, LD, ISO, etc. So I believe each parties, including Ministry of Health and Ministry of Environment, Forestry, and so on should agree which data exchange and data model standards needs to be adopted. And I believe recently also we see some development on web services and application programming interface, which use standards such as HTML, XML, SOAP, JSON, and etc. that can be used for interoperability between application once standards regarding data has been established.
Okay.
Thank you. Yes.
So
Agree, Pak. 100% agree, Pak Bambang.
yeah.
Okay, thank you.
I think by doing that, Professor Bambang and also Pak Setiaji, I think we also need to raise the question of having a center of excellence, right, for this data integrations. What do you think? Is it very much needed, or we can just, you know, complement of what the Satu Data Indonesia is doing right now. And certainly it will be more than, you know, more than enough for us to actually work on the data interoperability and the regulation altogether. What do you think, Pak Setiaji?
Yes,
And
we already have a Perpres Satu Data, yeah. And also Bu Dini already mentioned about the role of the Bapenas to
yeah,
make sure can be interoperability within other sectors. Because of that, we can together with Bapenas, yeah, sit together and then defining the variables, metadata, and then we can use their Satu Data platform, yeah, to make sure can be interoperability within other sectors. Bu Dini already mentioned about the SPLP. SPLP is a data exchange developed by the Ministry of ICT. So we can use at the site using this. The important thing actually not of the technical. The issue is non-technical, usually.
yeah, yeah, of course. Non-technical is harder to solve, yeah. But I think I will just you know talk to you more on this together with Ibu Dini and Professor Bambang. I think we Indonesia needs to establish center of excellence to it is as a strategic hub which can focus on the intelligent health system that we are promulgating through Satu Sehat and also with together with BMKG and many other respective institutions, so that we can have an open innovations. Yeah, we can establish this center of excellence. So I would like to stop here, but I will let Pak Setiaji and Prof. Bambang, if you have 1 minute closing remarks for our session on data standard and national regulation. So I'll let Professor Bambang start first.
I would like to touch about the AI computing infrastructure that is needed for AI model development and deployment. So that will include a number of levels. From the bottom level is the infrastructure that includes a GPU and low-level software. And the next level is AI model development that include dataset engineering, AI model training and fine-tuning, inference optimization, and AI model evaluation. And I believe we also need the AI model repository, and that's the third level. And in the fourth level, there is engineering, AI engineering, which includes, for example, prompt engineering, AI interface, retrieval, augmented generation, and so on. And in the upper level is the AI application, in which we can develop a chatbot, information aggregation, workflow automation, and so on. So that
Okay,
concludes
thank
my.
you. Pak Satyaji, if you wish,
Yeah.
1 minute, certainly.
Okay, 1 minute. So I need to address two topics, two themes. I mean, two issue about the human resources. Yeah. Not only when we develop the variables, but also when implementations. I mean, already have the data, standard, etc. The important thing is how we can recognize, because the health data is very challenging here to knowing about that. For example, in the common languages is stroke, but we cannot find our health data because usually the clinical data is not stroke. And then the other side is about privacy, data privacy and security. We need also consider about that. So we need to develop the platform more secure, and but we can access for that. Thank you.
Yeah, thank you so much, Pak Setiaji, for that very important closing remarks. Is coming back to that is building capacity through talents, and also Professor Bambang was saying that the need for the infrastructures, the modeling, as well as the expertise in prompting and making use of the latest AI model. So with that, I would like to end our session. Again, thank you, and we'll stick to your advice further after this national consultation, so that the blueprint of the data integration, climate health resilience can be achieved later this year. Thank you so much.
Thank you.
Wassalamualaikum
Thank you.
warahmatullahi wabarakatuh.
Thank
Terima
you.
kasih Pak
Yeah.
Setiaji.
Oh, yeah.
Thank you so
Thank you,
much,
Pak Imam.
Prof. Hamamriza.
Okay, so I will just go ahead and hand to the next moderator for the session is Andreas. The time is yours.
Before we go to the third session, we'd like to have two screenshots. So on the count
We
of
already did the screenshot, right? No need to do that.
okay, noted. Okay.
Okay.
All right. Moving forward to the third session, this will be part of the early warning systems. So one of the recommendations to be discussed is to integrate health data into existing non-health early warning systems. So Indonesia's disaster warning systems already track environmental risk like floods and landslides, but it could be expanded to include critical health data such as disease outbreaks, vector density, and other climate-sensitive health risks. I'll be guided by three special panelists and speakers. So moving forward, I'd like to invite our speakers.
Hello. Good evening. Good afternoon.
Good afternoon.
Hello, Pak Udrek. Welcome. Thank you, Pak Udrek.
Yeah, thank you, Pak Hamam.
Bu Violenta from National Research Innovation Agency. Terima kasih. Yeah.
Thank you, Pak Amam.
Right.
And also Pak Purwadi, ya. Purwadi.
Yes, Pak Purwadi.
I hope he's still in.
Okay, baik. So Pak Udrek, please show your presentation or any kind of materials to be discussed.
Yes. Okay. Sorry, wait for a moment. There is something wrong with my computer, sorry. Oh no. Okay. Any, you see my
Yes.
presentation? Okay. So because we only have 5 minutes, so distinguished ladies and gentlemen, I would like to give us some short information regarding to the activity, especially for natural hazard. But actually, we are also working on other hazard, including the health relationship. So sorry, my presentation is in Bahasa Indonesia. I didn't know that we would like to make a presentation in English. So regarding to the our decree of for disaster management, so we differentiate the disaster with the natural, non-natural, and also social. And in the non-natural, we have what we call is epidemic and also what disease. So it is actually now BNPB doesn't only deal with the natural disaster, but also natural disaster, like when we deal with the COVID and also zoonosis. And it is also very important thing for collaboration, because actually we have regulation also what we call is a data representation, data representative, and also thematic group for disaster and also climate change. So according to the Badan Informasi Geospatial, Geospatial Information Agency, there is a regulation or decree that we have a group of thematic session that also led by BNPB, and it is the role is how to manage the production of maps, hazard map, especially for every data representative. It is including a lot of institution that has their own specialization for every hazard. And as you know that the something that we try to calculate, especially for BNPB, is risk, where risk formula is hazard multiplied by vulnerability and divided by capacity. So it is something that we deal, including also for the related to the health, like disease and epidemic or pandemic. So it is something that we would like to inform that actually we are already now working together with Ministry of Health regarding to because Ministry of Health also has a role to be a data representative for epidemic and also for disease. What is wabah penyakit in English? So it is some regulation and also the methodology
Pandemic.
that we like also including the zoonosis. And here we can see that we are working now in malaria, dengue, I don't know, campak, diphthery, and also hepatitis. So it is five kind of the disease right now is epidemic disease that now we are working together to create the potential hazard map. It is something that now we are working on. So it is a kind of the result that we are now produced for a dengue, that the colors inform us the red is higher and green is lower. So it is something that now also now we are working also for a zoonosis map. So it will be renewed every 5 years. And from the Ministry of Health, we also get such kind of this information, something that different from what we produce in here. Here is the information about the risk, but based on the area of a provincial level. So it is also now we have already have such kind of this product. And actually, everything that we have already produced, especially in the natural hazard, we put it in this website, and this website is actually open. So we have already provide the services for all of the maps that we produce. So you can open it in like the ArcGIS on other QGIS, GIS, and other GIS software. And you can see here, we also can calculate some information like the how many province um, that has, let's say, the earthquake hazard, how the area size, how many people, potential people that will be, and also the potential
impacted.
loss, something like that.
Mm.
And actually, right now we are working in the multi-hazard early warning system. And it is the flows. Of course, we also use big data and also artificial intelligence for that. So it is a kind of the multi-hazard that we are now working on. And of course, the source come from a lot of related institution and also from the crowdsource. And it is a big platform actually for multi-hazard early warning system. And this warning system, of course, we also build such kind of siren, but also send by using some of digital device like social media and etc. So actually, of course, it can be used not only for natural hazard, but also for other kind of the hazard. So it is something that I can inform you. I hope that it can be useful for us to discuss later on. Thank you.
Terima kasih Pak Udrek.
All right, thank you so much, Dr. Udrek. Amazing insights and great presentation. Dr. Michael Purwadi from BMKG couldn't attend the session. So moving forward, we'll have another expert speaker, Dr. Violenta Marpau, expert engineer at BRIN. The floor are ready for you.
Oke, izinkan saya share. Apakah sudah terlihat?
Sudah, Bu.
Sudah terlihat Bu Fiorenta.
Wait a second. So, good afternoon, everyone. Thank you for having me here during the sleepy times. So, in this session, I would like to present one of our project called Integrated System for Preventing, Detecting, and Responding to the Zoonotic and Emerging Infection Disease. This is actually a BPPT project and been done until 2022, early 2022. So as we know that Indonesian become a hotspot emerging infection disease, and as mentioned in 2014 by Asian scientists that East Asia become the hotspot for emerging infection disease. Until right now, also the Ministry of Health have a weekly report about the emerging infection disease cases in Indonesia, and it is still happening, such as mpox, avian influenza, rabies, and so on. So we know that the zoonotic disease is caused by the germ that spread between animals and people, and 75% of that disease is transmitted to the animals and from the animals to the human. So, but in 2016, if I'm not mistaken, the cause of outbreak of emerging infection disease caused multi-aspect impact that many casualty due to the unpreparedness of the system to synergize. So therefore, the world expert recommend us to use One Health as the concept used to address the threat of zoonosis. So One Health is the safer environment, healthy animals, and healthy humans. In Indonesia itself, we built a SIZA, it called System Informasi Zoonosis dan Emerging Infection Disease. So we have three term in background when we built the CISA. One is One Health, is the effort to improve the competence of the government of Indonesia itself for the prevention and control the disease. And the second part is the coordination between stakeholders. We have a collaboration with many ministries of agencies such as Ministry of Health, Ministry of Agriculture, Ministry of Environment and Forestry with PMK as a coordinator. And also we have tools for communications and sharing the information. The tools we call as the CISA, Zoonotic and Emerging Infection Disease Information System. So this is a pilot area that we have been done from the 2016 until 2021 and early 2022. So since 2022, we as BRIN or BPPT integrate information up from the Ministry of Health, SKADR, Sistem Dini Kewaspadaan Respon, ISIGNAS from the Ministry of Agriculture, and Sehat Satli from the Ministry for Environment and Forestry. And in the platform of CISA 3.4, we add some information about the spatial modeling for potential rabies that been spread in several regions such as North Sulawesi, West Java, Central Java, and Yogyakarta. We also publish this into several article about the spatial modeling in rabies and malaria. In this publication, we concern about adding some environmental informations and also about the climate and meteorological data. So in ZISA itself, as I've mentioned, is an integrated system for three systems, came from the Ministry of Health that give surveillance and prevention and control of cases in human, and Ministry of Agriculture, cases in animals, and Ministry of Environment and Forestry about the detect, report, and quick response about wild animals. So the system, we call that as input data in CISA 2.0. And then we integrate it, and we have already make a product we call CISA.bppt.co.id. But since BPPT merged into BRIN, the system had been hand over to Cominfo since I think, if I'm mistaken, it's about March 2022. So this is what we done. So we combine several systems that belongs to several ministry, such the input data from the CISA 2.0 is interoperability data using API. It's collecting in one health site.cisa, and then the alert examination by INARIS, BNPB, and so on, and we combine it into interoperable data and to make connections between surveillance and the managerial users. So to do that, we also use AI as a big data to confirm what the opportunity that we can take it from the system and the data that many ministry have already have it. So the CISA is we call that established support. So we can catch the key feature about what is acceleration of strategic response in dealing with issue that develop in society, and what the strategy to handle the potential outbreak, or we call it kejadian luar biasa. So while we using a big data to govern, we have challenges and solution. The challenge that what we face was it do not cover all zoonotic disease and emerging infection disease, and also the mechanism and production for the genetic alert are not yet optimal because we have to make integration with different pattern from the different system, and the business process for anticipating and overcoming outbreak, which is still difficult to define when the local governments actually who have the right to say the outbreak case or kejadian luar biasa in their area or region. And the solution that we taken and put into the information in the integrated system is to enrich the intake of information using web scroller or big data analysis, and then also adding spatial analysis such as risk map and potential model of spread disease spread that we already put some of meteorological data and climate data, because some of a factor disease in zoonotic and emergency disease related to the mosquitoes. And we also adding economical analysis such as total economic value for the health. So for the big picture of our project is to interface and coordinate to and between high-level users. And we also have a support module for preliminary analysis while we have facing a lot of data, but we have to know fast what's the information are needed to be taken for recommendations. And the third is alert and warning intended for managerial level, and also the interconnection of with One Health CISA applications. So the big picture of CISA 3.0 is mostly for information provider, for policymakers, where we can anticipate potential outbreak of health emergency and anticipate the escalation of health emergency status, handling health emergency, and post-event analysis of, or we call it lesson learned from outbreak or health emergencies that have occurred. This application also has a door for vertical and horizontal coordination before, during, and after a health outbreak or a health emergency. So when we do the project, we do have collaboration with many partnership, such as Ministry of Environment, Health, Agriculture, Red Cross, BMK, BNPB, and also FAO and World Health Organization, and also USA and Australia, Indonesia, health security membership. Maybe that's for my presentation about what is system that we've done for related about the zoonotic disease and emerging disease in Indonesia. Thank you.
All right, thank you so much, Dr. Violenta, for the material and the presentation. Moving forward, we have Dr. Purwadi, the Deputy Infrastructure for BMKG. Please present your stuff.
Okay, thank you. I will share my presentation first. Do you see my presentation already?
Yes.
Okay, thank you. So, good afternoon, everybody. So, my name is Purwadi. I am a Deputy Chairman for Infrastructure in BMKG. I would like to present to you about several early warning systems that we manage in BMKG. I'm sorry that I don't know the presentation will be in English, so I will write it in Indonesia, but I hope that you can understand it. So this is about the law, the regulation that manage BMKG is the law number 31 2009 about meteorology, climatology, and geophysics. So in this law, it is mentioned that the government shall to occur the activities on meteorology, climatology, and geophysics, and this activity is done or is managed by an agency, yes, the BMKG, and the activities itself in the eighth paragraph are about the observation, about the data management, about the services, about the research, engineering and development, and also about the international cooperation. So you can see in the right side a lot of our facilities. In the upper side right is our data center. So we have four data centers with high performance computing. Every one high performance computing is dedicated to every aspect. For one for meteorology, one for climatology, and one for geophysics. Also, there's another high performance computing that is used by maritime meteorology. In the middle, you can see we call it the Taman Alat, a garden of equipment that it measure about 20 meters by 20 meters, and inside you have several equipment for meteorology observation, like wind, temperature, different part of temperature, and etc. And below of it, you can see the equipment that observe the lightning. So we are also detecting and trying to have a measurement or a position of the lightning that happen in every point in Indonesia. So we have this equipment in the garden, a green garden. In the bottom, the left, you can see there is a thermometer that measures the temperature in different deep of soil. So there's one that measures the temperature in the surface. The other is 20 centimeters below the surface, 50 centimeters below the surface, and etc. So we have the different temperature of the layer of the soil. So that were part of our observation. So this is the main part of our observation. We have a lot of things. So in the left, upper left, you can see the automatic weather system. We have 13 AWS or automatic weather station, or agriculture automatic weather station. And we have more than 5,000 conventional, means not automatic, equipment for measuring the meteorology. We have also 1,328 the automatic rain gauge, is the equipment that measure the rain. Also the microclimate station, 27. We have on the right, upper right, we have the coverage, our radar. We have 42 radars. Indonesia is still lacking. We need 75 radar, but now we have 42 yet. Also, we have AESRS, is the equipment to measure the intensity of the sun, ray of the sun. So we have around Indonesia, there are 35 equipment that measure the sun, the ray of the sun, the intensity of the ray of the sun. For the seismic activity, we have 553 seismograph from Indonesia and 2,590 accelerometer to measure the shaking caused by the earthquake or by another thing. And one of the most important equipment in BMKG is AWOS is the weather station that is dedicated for the airport. So we have 107 equipment. It means that we manage or we monitor the weather in the 107 airport in Indonesia. It measures wind speed, wind direction, temperature, pressure, solar radiation, rain, visibility, lightning, and etc. So we have a lot of sensors. Our data is about 1 petabyte at least a year, and we manage all this data in our data center. This is the product produced by several division in BMKG. So in the left side, there are two maps. The upper is the fine fuel moisture code. Is the measure of the soil, that it is easy or not to be burned by heat or something. So this measured directly from the our sensors in the field, and we have an algorithm in order to extrapolate to another place. In the left below is the rainfall, the mean of rainfall in period 1981 to 2018. So it is also a product that has been built using the measurement data. On the right side, you can see on the upper is the people from different extreme weather, like thunderstorm, heavy wind, flooding, and forest fire. So we can see that different color. The green, it means it is safe. Yellow means we have to be alert, and etc. And also you can see in the bottom, we can predict for the tomorrow and for after tomorrow. So it means that this map is produced using some algorithm in order to have the best prediction. In the right below, the one in those area that green, they have to be alert that they will have heavy rain on November. So I have explained that we have some product that based on algorithm. It's also what is happened in our early warning system. So we have 3 early warning system in our office. We have a tsunami early warning system that is built on 2008. It predict, it measure the earthquake and predict the tsunami, where it will comes in the onshore or on the, and the second early warning is extreme weather, MEWS, built on 2000. and the climate extreme early warning CEWS built on 2010. So all these early warning system need or built based on some algorithm that evolve more perfect year by year. All this early warning system is now integrated into one product. We call it multi-hazard early warning system, or MHEWS, that people and everybody can see it in the website of BMKG or in application. So we try to move along with Society 5.0, where we provide the information to the people, not just provide the information and the people comes to see the information, but we deliver the information to the people, to the one that have the application info BMKG, for example. We can deliver the exact information of whether in area that he is still stand. So in this multi-hazard early warning system, we put information on the last earthquake, also the impact case weather forecasting, the flood or drought, etc., and the extreme weather warning, also the potential of forest fire warning in the area that the person is stand. This is the view of application info BMKG. So in the middle, you can see that they will give you the information about the rain, the weather in the area. For example, he is in Bunaken, and also the alert that you can it show here that the alert is about the high rainfall in the Bunaken and 20 October at 20:08 local time. Also, on the right, you can see the last earthquake that happened in Indonesia, and it is in Sunda Strait. Okay, so that is about the early warning system that we manage in Indonesia, and now it's about the AI that we need in order to produce a better product, as I talked just before. So the first one is the AI that we use for quality control of data. So you see that we have a lot of equipment of sensors, maybe more than 10,000 sensors. So we need to make quality control this automatically, and we will use AI to that. Okay. This is we can. So there are several two level of QC. The first one is the QC for the raw data, and the second one is the QC for the processor data. And the QC itself is a different thing. For example, plausible value check, plausible rate of change. So the value cannot change very fast because it is nature. Also, time consistency check and internal consistency check of the equipment. We use different artificial intelligence algorithm for that. Autoencoder, K nearest neighborhood, isolation forest, long short-term memory, and K means in order to manage different QC in our data. Also, you can you see that we
The time is up. So sorry about the time.
Yeah.
Thank you for the presentation.
Okay.
We'd like to move to questions from the audience and closing remarks from several speakers. Sorry
Okay.
for the presentation.
Okay, thank you.
Any questions from the audience?
I think, and yes, I'll go ahead and post the roundtable questions to the expert network that we have here. So our first question for this group, as we have heard, from the aspects of zoonotic diseases, and we have also heard the disaster management part, and we all finally learned from Purvadi about the infrastructure, and unfortunately we had to cut short in the middle of a fantastic discussion on quality assurance part. So now I'd like to learn that, the non-health early warning systems that we are seeing here. So what are the top 3 key attributes that should be there in the health early warning, or maybe a combined health and non-health early warning? So if from the technology point of view and the data point of view, we need to figure out that these are the top 3 key attributes that should be there in a combined early warning system. So what should those top 3 attributes would be? And I'm taking cue from the previous sessions as well, where experts have talked about interoperability, HL7, FHIR. They have also talked about the different types of data. So now it would be good to hear from your point of view that we have just covered so many AI solutions that Pak Purvadi has mentioned, the autoencoder, KNN, and other systems. So what are the key things that need to be there in a combined system? So can we have a round robin, please, with all the speakers? So we can start with Ibu Fiolenta, and then we can move to Dr. Udrek if she is present, and then Pak Purvadi to answer this question.
Okay. Good afternoon. So, my opinions about this is that we already have systems in each ministry or agency that have a specific output for their ministry. But what I want to emphasize the integrated system that we can link all together, especially for the disease and for the climate, as we been highlight in this webinar. So in my experience about how to do the system or the early warning system, we have to separate it into two kind. Is for a disease that is spread by the animals, we can predict that by the behavior of the animals and the factor of the human animals, that which area or environment, which is we include the data, climate data, to accelerate the disease. So the disease already there, but because of the change of climate and the factor of disease as what to say, for the malaria or Aedes aegypti for the uh, uh, mosquitoes. So they depends on the environments, the meteorological data, and so on. And the second one, where the disease is not related directly to the environment, maybe really related to the behavior of the patient itself. So these have two terms that we have to separate it, and maybe using the EI or big data analysis, and then we combine those system into one system that give more input. So this is maybe useful for Indonesia. Maybe that's for my opinion. Thank you.
Thank you. I'll turn to Pak Udrek for your views.
Yes. Okay, so for me, three important point is first is understanding risk. So if you don't understand the risk, so you can do nothing for that. It is also including the how we understand about the climate affected hazard or how climate enhance our hazard. The second is spatial information or spatial perspective, because right now I think when we talk about the hazard, disaster, including the disease, we need to understand about where it is and how big the effect or of this disease. So it is the second one, how we can think spatially. And the third one is end-to-end. End-to-end mean if in multi-hazard early warning system, there are four four uh, point that from the end to end. First is yes, understanding risk, and from the understanding risk, how we can uh, monitor this let's say disease when it occur, like when maybe the important experience when we have COVID. It is at the first time, of course, we have a problem to understand where it is and how to handle and etc. So it is the second is how we can monitor that one. And after we can monitor, so the third one is how this information can be delivered doing a side scan of the technology. And the fourth point is how people respond to the information that delivered by using such kind of all of the technology itself. So if we cannot thinking from end to end, the first is understanding risk to the people response. So the warning become unusable. So it is my answer. Thank you.
Thank you, Pak. And I'll turn to Pak Purwadi for the last couple of minutes we have.
Yeah.
For the
Thank you. So, yeah, I think the three most important thing that we need. The first is the data. What kind of data you need to do what do you want to do? For example, we produce data. The product that Mr. Sena has already presented in the morning in the previous session comes from the data that we produce. So we need to know about the data that you need to. Also, the second thing I think is the regulation. The regulation, how we can share the data, for example, from BMKG or from Ministry of Health, how we can, although we have the regulation of one data in Indonesia, in practical view, this regulation is not really followed by many agency in Indonesia, because the data is too general, too generic. So we cannot use the data from one data policy that we put together, assemble together. We cannot use it for our special purpose. Example here, to predict for example, the non-hazard natural hazard. Yeah. The last one I think is the human resources. I told several times that we need algorithm in order to build our product. I think also in need algorithm in order to build the product together, the integration climate and health data, for example. So we need the human resources that is capable to build that algorithm and to make it better and better in years to come. I think that's three answer that I can I have for. Thank you.
Thank you so much. So, Andreas, over to you for this brilliant session and for taking this forward to our last and final session. We heard in this session about the importance of different types of data, especially from the perspective of One Health and zoonosis. We have heard human resources and infrastructure aspects, the data that BMKG produces, and we also have learned about the importance of partnerships in this and coordination that is required to ensure data sharing that should be in place, and how regulations could be reflected into practice. So now turning to our final session, and Andreas, over to you for the next moderator. Andreas, you are on mute if you're speaking.
All right, thank you so much, Dr. Violanta, Dr. Udrek, Dr. Purwadi, for the presentation on the early warning systems. Very insightful. Right now, we'll be moving forward on the session number 4. We'll have a moderator from MBZ UAI, Dr. Hosni Gedira. So, Dr. Hosni, the stage is yours.
Thank you. Thank you for introduction. Let me share quickly. You hear me?
Yes, you're audible.
Okay. So, see my slide.
Need to put Dr. Hosni on the spotlight, please. Okay. Got it.
You see it?
Yes, yes.
Okay, so good afternoon. My name is Hosni Gedira. I'm a Director of Research Engagement at Mohammed bin Zayed University Artificial Intelligence, based in Abu Dhabi in United Arab Emirates. Happy to moderate this session and to continue our engagement as a university, as me personally, with the work of Corica and the leadership of Dr. Hammam. So the session, and this is the last one, is more about strategy and cooperation for data integration. So happy to have 3 speakers in this session, Dr. Leah, Mr. Nabil, and Indarto. So we'll go over mainly the topic of how strategy and cooperation for data integration can help and contribute to this effort, especially in the context of establishing an innovation hub in Corica for climate technology and data solution. So we'll invite like speaker to focus their contribution around 2 key questions. The first one about what tools and systems and communication protocols should be developed or enhanced to ensure that local government and health authorities can access climate health data in real time. And this is very critical, especially the project that were presented during the first 3 sessions, where many government stakeholders are engaged. So it's very important to make sure we have the appropriate protocols for data exchange and data integration. And the second key question is about what kind of public-private partnership should be given priority to ensure knowledge transfer and technology exchange between private tech companies and research institutions and public health authorities. We know that many stakeholders have a very critical contribution to such large-scale and multi-stakeholder projects. So it's very important to develop and define the kind of protocols as well as kind of public-private partnership, because most of those efforts are done through different stakeholders from government, private sectors, research institutions, and also tech companies. So how we can create this platform to bring all those stakeholders in a common platform for one goal. So we'll start. I think we are on time. So we have we have about 45 minutes for the last session. So we'll try to finish on time. So as for all speakers, the previous session, we try to stay within the 5 minutes for each speaker. So we start with Dr. Leah. If you have some slide to share, please.
Okay, you can see my slide now.
I think I have to stop sharing mine first. Okay, so can try to connect it.
Can
Yes,
see
we
that
can
as
see
well.
them. Yeah.
Okay, you can see my slide, no?
Yeah.
Okay.
I can see your slide. Yes.
Thank you very much. Thank you for the opportunity. Good afternoon, everyone. My name is Yulia Tuswada from Korika. And in this session, please let me give some introduction first about Korika, the collaborative orchestration organization supporting artificial intelligence in Indonesia. Okay, so the artificial intelligence is already transforming industry and driving innovation in various sectors, but with great power comes great responsibility. We need a national strategy to ensure that this powerful tool is harnessed for the greater good. And in Indonesia, BPPT in collaboration with Helix launched AI National Strategy to 2020-2045 on August 2020. It contains national policy direction in the development of AI technology, which focus on five main priority areas: bureaucratic reform, health services, education and research, food security, and mobility and smart cities. In the AI National Strategy, specifically Chapter 8.3, states the need for an organization to orchestrate the enhanced collaboration ecosystem. Then BPPT initiated the Artificial Intelligence Innovation Center, or PICA, on March 2021 as a bridge to the formation of an orchestration institution. And after that, Korika is established on August 2021 as an orchestrator organization in the form of an association that encourages the enhanced collaboration, government, industry, academia, community, and other parties to foster innovation in the field of artificial intelligence. Korika is designed to be a sustainable organization with the support of Helix element in its operation from, by, and for the community. Korika have a Senate in the structure organization, accommodating alignment function of Helix interest in the Korika AI ecosystem. Currently, our Senate member consists of 6 government representatives, 8 industry representatives, 7 academic representative, and 3 community representative. And Korika has 7 core principles: inclusive collaboration, professional and transparent, adaptive and agile, grow together, healthy competition, Indonesia advantage, and based on value creation. We need to highlight the inclusive collaboration principle here, supporting the data integration strategies between all parties. And one of main program in Korika is AI innovation in the form of a green challenge. And Korika try to accelerate the implementation of AI in priority areas, including health service. And one of our green challenge in AI innovation is AI implementation in climate resilient health system, which is a collaboration between Ministry of Health, Ministry of Environment, BMKG, Korika, IMEX, Institute for Health Modeling and Climate Solution, and also MBZ UAI. And then announce the National Strategic Alliance for Responsive Health Adaptation to accelerate the multi-sectoral action toward health protection. And we announced this initiative as Climate Smart Indonesia. Of course, we need support from all agencies, especially regarding the data integration strategies to accelerate the implementation of Climate Smart Indonesia. I think that's the end of my presentation about Karika in supporting the collaboration between AI ecosystem. Thank you for listening.
Please
sorry, I was muted for. Okay, let's go for our second speaker. So we go with Mr. Nabil.
Second
Hello, can
speaker
you hear
should
my
be
voice?
representative
I
from
just unmute
New Robot.
audio. Okay.
Bu
So
Netya di robot will
I
be first.
second.
Yes, Bu Netya
Okay.
dulu.
Let me present. Wait.
Okay. So Dr. Rosti, Nitya will represent New Robot.
Okay.
All right.
Have you see my slide?
Nabil, let Nitya go first, okay?
Okay.
I'm sorry.
So let's Nabil. So let's keep Netya to start first, and then we'll keep your
Oh,
talk for the last one. Sorry for
okay.
that.
I'm sorry. Right.
So Netya, you have some
All
slides
right.
to share? Okay.
All right. Can you hear my voice now?
Yes. Yeah.
Okay. Good afternoon, everyone. So it's a great honor to be here representing Pak Indarto from Nerabot. We are a digital laboratory platform at the forefront of transforming diagnostic healthcare through innovative technology. And I'd like to emphasize the critical role of the digital solution in addressing some of the world's most pressing health challenges, particularly as we face the intertwined threats of the climate change and infectious disease. And at Neurabot, we specialize in digital pathology using advanced technology such as artificial intelligence for enhance the accuracy and efficiency of the cancer detection, especially. But in this case, for the malaria as a disease with a devastating impact on the human health is a primary area where innovation can bring the transformative result. And maybe next. Okay, this is our journey in Neurabot, and by 2021, we have collaboration with several laboratory, and recently we initiated innovation with collaboration with Universitas Gadjah Mada to digitize the malaria slide and enabling the faster and more precise detection of the Plasmodium parasite. And this initiative underscores our commitment to fighting the malaria and disease. And for especially this disease is very deadly and highly sensitive to environment changes driven by the climate change. And maybe and our goals by 2024, we have several scope of the digitized specimen in the malaria and especially in the cancer data. Next. Yeah, why we focus on malaria? Because we have a very challenging in malaria as an infectious disease which spread through the bite of the world deadliest animal, which is a mosquito, and then it is significantly burden the global health system in developing countries, including Indonesia. Next. Yeah, this is the image of the mosquito and the human that vary and the number of people killed by the animal per years and by digitizing by using the technology this not about only the technology but using the innovation to create a future where disease like malaria no longer pose such as devastating threat to human, especially as a climate pattern C by working together, combining our capabilities and leveraging the power of the digital solution, we can pave the way of health resilience in the face of the climate change. Next. Yeah, this is our solution that we recently developed with Universitas Gadjah Mada with a collaboration with Tropical Medicine, and we do the digitization of the slide specimen of the malaria to see the plasmodium inside. And then we also using we can provide user with the image of the entire slide as we know that like a whole slide image, and by using our platform now, we can select region by 20 minutes to produce the AI solution. And but currently we still under the development of the AI model. This is the malaria ecosystem that we will build and then by the hospital, clinical and laboratory, which they have the slide specimen for the malaria case, they can help us to digitize the slide specimen by using our microscopic scanner or slide scanner. And then by using our platform, they can do some data management and then transfer knowledge from the medical doctor, like a tropical medicine, and combine with the engineer to build the AI model for the malaria ecosystem, especially in our current stage is plasmodium detection. And for the malaria digital hub, we also have a big dream to have the big data itself to store in a Satu Sehat, and also we can build our artificial intelligence together with many partners. And next. Yeah, this is the step of the malaria detection that we are trying to have the malaria surveillance, assisted the primary diagnostic of malaria, assisted the quality control of malaria, and know how to produce the anti-malaria drugs and efficacy monitoring. Next. Yeah, okay. Thank you for the opportunity to share the Neurobot vision by today. We are excited about the potential for meaningful collaboration to have a safeguard public health in years to come. Thank you very much.
Thank you. Thank you, Natia, for this presentation. It's very interesting, the work that you are doing, and you already see a lot of synergy. So you are representing the private sector in those kind of public-private partnership. I think the last presentation would be Nabil about how data science Indonesia can contribute to such like government and public partnerships through civil society, through organization like groups. So Nabil, so please go ahead and share your slides.
Yeah, thank you. Have you see my slide?
Yes, yeah, just put in full screen.
Yes,
please. Yeah,
sure. Yes. First of all, I want to say thank you to the committee and also Mr. Hosni for hosting me. And I'm sorry because of my slide is Indonesia, but I can maybe after this I can present in English. Basically, from Data Science Indonesia, we have a concept and also framework to do partnership with government beside from the public sector and also the private sector. We call it data from rakyat untuk rakyat, yeah, from citizen to citizen. So this is what we plan to develop, how we build our data sovereignty for Indonesia. First of all, I'm the chairman of Data Science Indonesia, one of the data science foundation and the largest communities in Southeast Asia. We have beyond 20,000 members right now. And also I'm involved in Korika as director of the industry relations. Thank you, Prof. Hamam, for inviting me. And also I have my own consulting and several projects in government and also private sector. So I also implement what my framework is. Okay, so this is from my perspective or my from the DSI, Data Science Indonesia perspective. So who wants have own the knowledge in certain area, they will be have influence in that area. So this is my philosophy from or about the data sovereignty or data exchange urgency. So we benchmark from the America and China. So many big company like Google, Facebook, Meta, Alibaba, Tencent, more than 2 billions members, 2 billions customers across the world that use this platform. From this, Indonesia will be rich in terms of data and more rich or richer than Facebook or Google if any data local, any data steward, any data provider, data owner can build together and we build our own sovereignty. We have more than 1,000 state-owned enterprise, government institution, startup, unicorn, and so on. So we are rich in our own data, but if we want to have specific knowledge in our area, in our own area, we have built our data sovereignty. That's why if we want to manage our data, we have to unity, and we can see all of knowledge, all of information across our area in Indonesia. So this is the philosophy that really, really important. We start from the case study one about the health that we discussed. If we want to how to make the data exchange between hospital, that how hospital can coordinate and solve our government problem in terms of like dengue or malaria or another disease. We can start from our specific data in each hospital. We can see in each hospital they have their own data, their own customer, like one of the local hospital from the government, RSUD, Rumah Sakit Unit Daerah. We can see any disease we can put into one table or into one data, and also we can do cross with another, let's say, across from the public hospital to private hospital. For example, hospital from Lipo, we can exchange our data, and if we concern about the data privacy, about the PDP regulation, we can build our data privacy engineering, so we can do anonymous about the hospital ID or the username or the name of the patient ID, so we can change. This is just for the illustration, for the example. So from this approach, we can do more better in terms of prediction in how we can predict the disease, specific disease. We can anticipate to allocate the budget to the drugs and so on and so on. And after this, we can build our own knowledge about improvement in national health services. This is one of the example that maybe we can try between two hospital, between public hospital to the private hospital. So the challenge is how we can get access the hospital to give their own data, to make sure the data is privacy, we comply with the PDP regulation. Nah, and how we can as orchestrator and Data Center Indonesia, Korika, and the others, we can see as become to the bridging between the stakeholder and also to orchestrate the program. And the data privacy engineering, it's clear. We have this approach. We know how to encryption. We know how to integrate the data. We know how to make sure the data is safe. That's why this is for key component. For key component, we have the certified talent that are professional and comply with the GDPR certification. Since Indonesia don't have PDP certification, and the second one, we have to become the orchestrator between two organizations or more two organizations to share the data set. And the third is about the regulation. We have PDP regulation, and also the fourth is the one of the important that data privacy engine to become hub to manage the data exchange. Okay, this is the data exchange or data democracy platform. we can see this as a framework. After this, we can make the output as the application or open source for public. We have our own AI model and we can share to public, and also for sure for the user, the public decision maker about the knowledge or insight. So the output of the program is we can build the technology talent, tech talent from this initiative. And the second one, we can build and open our open source application software to the public. And the third is about the insight of the knowledge itself to public, to the government, to the private. So anyone can see the benefit of the data privacy exchange by doing data privacy engineering for sure in that platform. Okay, that's all from me. That's one of concept that I can share to you guys. Thank you.
Thank you, Nabil, for the presentation. It's very great to have this insight about your effort to facilitate and to educate as well the ecosystem about data privacy. Because
Yes.
here we're dealing with very sensitive health data that has some confidentiality, some challenging to share, but to have those protocol for data privacy to make all stakeholders like comfortable working with each other. So to close up our session, so thanks again, Dr. Leah, for sharing some insight about how research institute like Corica can contribute to such like multi-stakeholder approach. Thank you, Tia, for sharing the private. It's very interesting what you are doing, and hope that we can meet in my next visit in Jakarta to see how the private sector, how a company like yours can contribute to large scale projects, and how the private sector as well can fill some gaps in the ecosystem, because like government sponsored research institution or like organization like data science Indonesia, sometimes some tasks are beyond their scope. So the private sector is very, very critical to have this contribution. I think they give the floor to Dr. Hammam. If you have any closing remarks about the session, Dr. Koshik, if you have questions. I saw some question, I think, in the chat board. So we have question
Yeah, I
about
think
asking about
you can
yeah.
pose the question, Dr. Hosni, to just
I think
step
maybe
up
Nabil can answer one of the question because there is question about if there is any regulation obstacle in order to have an exchange of patient medical record even within its identity or private information without identity or private information. I think with your work recently you did with many stakeholders, including hospital, about education, about data privacy, how you can see that, what obstacle you see in terms of regulation in order to have this exchange of data?
In terms of regulation, there is no specific how we handle the what we call the specific data, especially about the health data. In PDP regulation, there is only mentioned that about the data should be managed and proper managed. That's all. Though, so there is no specific task or guidance how we can handle the data. So basically, from my perspective, my personal perspective, we can benchmark to the GDPR. So because of that, we can see how GDPR works, the specific special data, how we manage. So based on that benchmark, we can do some of data tokenization, data consent management, data privacy engineering, how we encrypt the data, and so on. So this is we're talking about the regulation. There is no guidance or specific regulation to how we handle data. And the solution is we benchmark to the GDPR, and so we also see another implementation data privacy in Indonesia. Maybe there's two solutions that currently I use.
Okay, so thank you, Nabil. So we all see that there is a lot of work that still to be done to set up like clear regulation to have this clear platform for data sharing and benchmarking. I think is very important, as you mentioned, Nabil, and you mentioned some other experiences, other countries. Is we don't have to reinvent the wheel, so we can have some benchmark study about what's being done in other countries and how it can be used to set up like a clear data sharing regulation, especially in the healthcare sector. So thanks, Nabil. So Dr. Hammam, the floor is yours if you have any closing remarks.
Maybe I just want to add a few things that was discussed during my session when I was moderating this for second session. So for the data interoperability and data standard, we certainly are not really complete yet. Of course, there are two regulations that we have identified strongly applicable to the data interoperability and also the use of AI, which is the one is the information and transaction, electronic transaction, ITE, and the other one is the currently just being activated, the GDPR, just like what Nabil was saying. So those two, plus several other presidential regulations such as the Satu Data Indonesia will be, the first batch of regulations that will guide us in order to work on data interoperability and data standards. And additionally, the new government with the new Ministry of Communication and Digital, I think it will reach out to many others regulation which is needed for digital transformation that includes data governance and data open data governance. That is potentially going to be one of the new rules and regulations for our work further. So with that, I think Corica will try to be something like the AI innovation hub, which includes ethics and regulations, policy, and many other aspects of AI development in Indonesia. So that will enable and foster collaboration between tech companies such as New Robot and many other startups, and also the research institutions. The new government also installed a new ministry, which is the Ministry of Higher Education, Science and Technology. So it is, I think, our response to really to make the linkage between industry and academia in order for us to have this public and private partnerships in many areas of development. Oh, by the way, I should note to you, Dr. Hosni, that we are planning to launch a national innovation challenge with private sector partners for the next AI Innovation Summit in 2025. And I think that will be, a major push, for making our national alliances for climate and health. So I think that's my other things that I want to say. And Nabil here is also part of our team that is doing hackathon and many other competitions and innovation competition for AI, together with Dr. Lia and many other experts from Corica.
We're
that's my
looking for it.
yeah. Right.
There other question from the audience, or if Dr. Kaushik wanna have some word to say?
Thank you, Dr. Hosni. I think we covered a lot of ground today. I mean, I think three of us, Dr. Hosni, Dr. Hammam, and I have been seeing this for the last 20 or 22 months, probably. And this is probably one of those sessions where we have learned most. I don't think we have more questions to be answered for the blueprint right at the point. But before we close, or we have closing remarks from Dr. Hosni and Dr. Hammam, I would just like to sum up a few of the discussion points so that we can agree on if anyone have any disagreement or dissent, they can post that, because everything is going to get recorded within the blueprint and will be put as a standardized document. So in session 1, we emphasize the need for strong coordination and capacity. In session 2 and session 4, we had overlaps. We highlighted the critical need for national data interoperability standards from very different perspectives. Session 2 also included a brief discussion on a center of excellence, a hub that could integrate advanced AI and climate science, the knowledge part and the policy part, to design and drive innovation, build capacity, and position Indonesia as a regional leader in climate-informed health systems. Session 3 was equally exciting. We learned about the zoonotic diseases and the importance of their inclusion, the inclusion of One Health vis-a-vis One Digital Health, and then focused on integrating health data into so many different existing early warning systems that are there and serviced by BMKG, BNPB, and other agencies in Indonesia. So expanding disaster warning systems to include health data becomes a key to more proactive risk management. And finally, in session 4, we heard Dr. Hammam, and it is a pleasant, very pleasant thing to hear that is a recommendation for establishing a innovation hub within Corica to advance the AI and the digital tools for climate health solutions, and expanding platforms like the AI Innovation Summit to empower government and fostering public-private partnerships. So this is the overall summary that we could have heard from today's web consultation. The culmination of this dialogue or discussion is going to be a report, the title of which you can see in all of our backgrounds, the Blueprint for Integrating Climate and Health Data in Indonesia. This consultation is just the beginning. The report will be shared with all of you before it gets finalized, and you will have the opportunity to provide your insights again in that report as it gets finalized. In the interim, if there is anything, please share those with the Corica team. And I would also encourage
for quite some time I've been working on unsupervised network detection on different types of.
Sorry, Dr. Kaushik.
Yeah. No problem. And finally, one thing is that from each of your institutions, it would be good to have one technical contributor to the report itself, since we will try to compile a lot of information from the presentations that you have all shared and try to include the important ones into the report. We are going to have a global consultation as well. We will include the insights from that global consultation into that report. We are expecting that to be done either in the month of, either in late November or early December, depending on when the experts are available. So with that, those are the next steps. Any final remarks? I think Dr. Hosni, and then we can turn to Dr. Hammam.
No, thank you, Dr. Koshik. I think I reiterate your message. I think it's very important, as you said, after more than 20 months of work that involving many stakeholders, not just at the national level but also international level. It's important to define this partnership platforms, especially when we engage with partner. They have different regulation. They see data from different angles. And so it's very important to bring all people around the same table. We try to do it many times. So we had many events that including healthcare authority operator, like private sector research institutes, and we know it's a challenging. It's not just for Indonesia, but also everywhere. Even here in the UAE, we're still facing challenges. We are a government university to get access to government hospital data as well. So it's always a challenge, but I think the new culture is there. So so people see the importance of data sharing using appropriate protocols for privacy and for all this healthcare operation standards to make sure that because we understand the challenge faced by healthcare operator for this aspect. I believe that we have to continue the dialogue and continue the engagement effort at different level. Me personally, I'm very optimistic that we definitely will be reaching our objectives in the near future, and to have this platform like engaging all the stakeholders and for our appropriate and for our noble cause.
Okay.
So Dr. Hammam?
Well, okay. I think much have been said about the objective of this first dialogue on the blueprint of integrating climate and health data. We certainly have discussed a lot of issues on that, especially from session 1 to session 4, which culminates on the strategic partnership for public and private to engage in mobilizing, these technologies and expertise actually to really advance Indonesia into AI and digital transformation for addressing the climate health challenges. Of course, the outcomes from of this workshop is some are still far-reaching, but I certainly believe that from our discussion today, we will have a roadmap for establishing the Center of Excellence for Climate Health System. We will also certainly will welcome some of the new regulations or I would say national standard for data interoperability, especially with the SPBE, the digital government that are growing rapidly, as well as really talking about how we can integrate the assisting early warning system, just like what Dr. Purwadi from BMKG was sounding to us, explaining to us, and also from what Dr. Ardasena was also saying. So I just want to thank to all my colleagues, experts here. There are really submitting their ideas and ready for all of us to implement this within a very near future. So again, thank you for all panelists, all the support that we got from the speakers, the moderators, and all the attendants of this roundtable discussion. I know the time is limiting, but certainly this is not the last discussion that we want. In fact, this is just one step in our journey to have a complete blueprint on integration of climate and health data for Indonesia. So with that, I would like to end our national consultation meeting today. Thank you so much. Thank you. And I will see you again very soon. Thank you.
Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Terima kasih semuanya untuk kesempatannya, Prof. Bambang. Yang saya lihat di sini masih ada Prof. Bambang, ada Dr. Lia, ada Pak Ardasena masih ada ya Pak. Ardasena, thank you so much Pak. Ardasena selalu konsisten. Bu Violenta dan yang lain-lainnya yang mungkin tidak saya sebutkan satu persatu. Salam juga untuk Pak Indarto dari Newrobot, ya. Ada dan pada moderator Dr. Kausik, Dr. Hosni, thank you. And thanks to myself as moderator. Thank you. Terima kasih.
Thank you everyone. Terima kasih.